Hi everyone, I hope you can all hear me. Can you just maybe raise your hand if you can hear me well? Perfect, excellent, good, excellent. You never know with these technologies these days. So what we'll do is maybe we'll give a few more minutes for people to join and then we can get started. Excellent. I might get started now that we've given a few minutes. So hello everyone, my name is Dr. Robyn Choi, or Robyn. I am the Program Director for the Master of Clinical Audiology program at the University of Western Australia, and I'm also a Senior Lecturer here as well. So today we'll be talking about Central Auditory Processing Disorder, or more of an introduction to this topic. This is a disorder that is not as well known as some of the other disorders out there. And I think it'll be useful for you to have awareness because there's quite a lot of children and adults out there who might be experiencing this disease. So we'll talk about what is auditory processing disorder or central auditory processing disorder, CAPD, the burden of it, the comorbid conditions that you can often find with CAPD, and the brief overview of management and treatment of CAPD as well. So what is central auditory processing disorder, or CAPD? It's an umbrella term used for children most of the time who have listening difficulty despite having normal hearing threshold. So often what you'll find is parents will come to you and say, I've went to the audiologist and I've tested my hearing or my child's hearing and everything is normal, but he or she or they still complain of listening difficulties. So that's when you can maybe start suspecting a child having CAPD. Adults sometimes also come to you and say, look, my hearing is normal, but I just really struggle to hear a noise, or I just really struggle to follow people's conversation. Again, that person might be suffering from CAPD. And it originates from the central auditory nervous system and is characterized by defects in the perception of the auditory signal. So often children or adults with this particular condition will say, it feels like someone's clapping constantly in the head as someone is talking. And you can imagine that's quite distracting and difficult for someone to understand speech, follow conversations, etc., etc. And these disorders these difficulties, are especially prominent in an unfavorable listening environment, such as classrooms or very noisy environment when there's lots of people talking at the same time. So often what parents will say when they come to a GP or a nurse or audiologist or any other health professional is say, look, I'll tell my child something over and over again, but they just won't listen. Now, one of the things that you can suspect is the kid or an adult having a hearing loss. So actual issue with the inner part of the ear, auditory processing issue, so something wrong with a higher order of the brain, issue with attention or memory. They just simply have attention difficulties and can't attend to the parent talking, or have very, very poor memory. Language issue, they have a language disorder that doesn't allow them to understand and follow instructions and directions. By other, I mean motivation. Often, as you already may know, teenage children often don't want to listen to their parents, and sometimes that could be a problem, or it could be a combination of above issues here as well. So CAPD is a very complex interaction between attention, memory, cognition, the actual central auditory processing, and the speech, language, reading, writing, and learning. So it's really complicated. And if one of these areas do not function well, it can manifest as a difficulty in auditory processing issue or attention issue, etc., etc. And CAPD is a failure of the central auditory nervous system to determine what the sound was, where the sound came from, and when the sound occurred. And these are some of the auditory processes that encompasses the central auditory processing. So things like sound localization and lateralization. Can a person identify where the sound came from? Left, right, up, down, etc., etc. Auditory discrimination. Can a person identify that the two sounds are different? So if I say ba and da, can you tell me that these two sounds are different? Auditory pattern recognition. Now, this is very important in speech processing because speech in general has a pattern, grammar, etc., etc. And if a person can't do that, they often have difficulty with speech. Temporal aspects of audition, such as temporal integration or temporal discrimination. So identifying when a sound occurred. So can you tell me if there's a break in between the words I'm speaking right now? So for instance, that's your temporal gap detection. Temporal ordering is identifying what sound came first, what sound came second. And again, that's really important for your day-to-day life functioning because if you can't tell me or tell people what the sound came from, very difficult to process sounds in speech. Temporal masking and auditory performance and competing acoustic signals are very similar, where one sound at one time prevents you from processing another sound at another time. So for instance, if I'm talking and if Tom is talking at the same time, can you ignore Tom and still understand me and focus on my voice? And auditory performance with degraded acoustic signals is if you're in a very noisy environment, so let's say if we're in a bar or in a club, not that we'll all go there these days, but if we are in those sort of environments, can you still understand my voice even though my voice is not as clear as it's coming through now due to other noises around you? Now, these are some of the behavioral characteristics children and adults with CAPD will often exhibit. So they often say they have difficulty understanding speech in competing messages, especially in noisy environments or in environments that are very reverberant. So if you think about those school gyms that have very high ceiling, lots of hard surfaces, and there's a lot of echo, often the kids will say, I find it really, really difficult to understand a teacher. They often misunderstand messages and they'll often say what or ha and ask for lots and lots of repetitions. They often have difficulty paying attention. They take longer to respond to oral communicating situations and have difficulty following complex auditory directions or commands. So if I tell someone, I want you to go wash your face, brush your teeth, come back, have breakfast, and pack your bags, a child with a central auditory processing disorder may go, so I wash my face and brush my teeth and what? And they may have difficulty remembering or following rest of the directions as well. And often children with CAPD also have difficulty with reading, spelling, and learning problems as well, which we'll go through in a bit more detail in the later part of the lecture. So what is the burden or prevalence of CAPD in children and adults? It affects about 3 to 7% of children in general, but in Aboriginal children, this increases to about 15%. So about double the amount of Aboriginal children are affected compared to your normal everyday kids. And the prevalence is high in populations with neurodevelopmental disorders such as ADHD and ASD. Up to 25% of the children with these comorbid conditions can also have CAPD. So that's quite high. That's 1/4 of the population. And untreated CAPD can lead to things like increased anxiety and frustration, social withdrawal because it's very difficult for them to interact with their peers and adults, low self-esteem, behavioral issues, and also poor academic performance as well. Now, CAPD in adults are not as well known, but we at the University of Western Australia are conducting some research with adults as well. So in adults, it affects about 1% of all adults in general and 4% of younger adults. But as adults get older and older, the burden or prevalence increases. And this is because, of course, there's hearing loss associated with this, but also the neurons start to demyelinate, which means that the processing of sound isn't as efficient as it used to be as we are when we're young. So the prevalence of CAPD increases sharply in adults aged 75 and up to about 60% of adults, even when the hearing is corrected or hearing loss is corrected. So CAPD, in the most simplest term, basically have normal peripheral hearing, but have difficulty making sense of sounds. So they'll often complain of not being able to follow phone conversations, having difficulty following conversations in a dinner situation, or having difficulty following sounds or understanding words when there's lots and lots of noise around. And these, in children especially, can be especially prominent in noisy environments such as school classrooms, because of course classrooms are very noisy environment. There's a teacher talking, but there's also fan going, aircon noises, other kids chatting, desk moving, things like that. And this can lead to poor academic performance, lots and lots of stress in these kids. Children with auditory processing disorder are twice as more likely to have stress response at the end of the day, high anxiety, emotional dysregulation, and later down the track, mental health issues as well. So what is the cause of CAPD? Truthfully, it's very unclear. But some of the theories that are out there are neurological deficits within auditory system, such as specific lesions on the brain, disorganization of the neurons, or immaturity of the neural pathways. So for instance, a maturation delay due to middle ear problems or central sensory deprivation can cause issues later on with the efficiency of the neuronal network, which can later on result in CAPD. It could also be genetic as well. So what we often see is that if a child is complaining of a central auditory processing or CAPD problems, often the parents will go, oh, actually, I've had those issues as a kid, or I still have these issues as well. And also, it could also be the result of auditory deprivation, meaning early and frequent middle ear infections or otitis media. So let's talk about that a little bit more. Now, while otitis media or OM itself does not cause CAPD, what OM does is that it causes fluctuating hearing loss. So when a child has OM, their middle ear is completely blocked with fluids or inflammation, and what that means is that the sound doesn't go through as efficiently as it would when the middle ear is aerated. So what this results in is an inconsistent sound stimulation of the auditory central nervous system, and it can also cause distortion of the sound perception as well, which means that it makes it very difficult for these young children, especially in the critical developmental period of up to 3 years old, to learn speech and acquire language skills, which means that speech discrimination and phonological awareness skills can also be affected in these children as well, and also in adults later down the track. And what we found is that children with recurrent otitis media perform worse on tests that assess the following skills, such as binaural interaction and temporal processing. So what does these two skills mean, and why are they important? So binaural processing is an ability to process sound using interaural intensity or time differences. So basically, it's your ability to process sound coming from two ears at the same time. So can you localize sound? Can you block out one sound and process the other sound and things like that? So this is very, very critical in noisy environments such as classroom. So you can imagine if a child struggles with binaural processing, it'll be very, very difficult to not only understand the teacher's voice, but to also learn as well, because learning isn't easy. Temporal processing is an ability to analyze acoustic signals over time. So can the child pick up patterns in speech? Can a child detect gaps in sound? So if I say, hello, my name is Robyn, you can tell that there was a gap between hello, my name is. Children who have difficulty with temporal processing can't detect the gap between those sounds, which means they just hear, hello, my name is Robyn, which is very difficult for them to process these sounds and understand the speaker. Temporal processing is incredibly important in processing speech and environmental stimuli as well. So what ends up happening in children with recurrent otitis media is that they end up having insufficient binaural stimulation. And this could result in binaural processing deficits later in life as well. And what we're starting to see is there's a potential link between unequal bilateral auditory stimulation and poor auditory skills, auditory attention later in life as well. So often children who have difficulty with auditory processing issues due to OM ends up having poor attention skills when assessed by a psychologist. And this could be due to a period of auditory deprivation or a period where the brain wasn't stimulated adequately. But this is still being investigated at this point. Like I said before, CAPD has lots and lots of comorbid conditions, which can really complicate the diagnosis and treatment, because often these difficulties overlap with other conditions, such as your ADHDs or language disorders, learning difficulties or disabilities, autism spectrum disorder or ASD, or even anxiety disorders as well. So it is very complicated for a teacher or parent or GP or any other allied health professionals to say, oh, this is ADHD or this is due to a CAPD. So it makes it really, really tricky to identify these children. But let's talk about how these comorbidities work. So when we look at children with CAPD and specific language impairment, what we find is that they have difficulty with temporal processing of auditory sound. And this is due to a combination of difficulty in sound brevity and rapid temporal succession. These children often have difficulty repeating sentences of two brief nonverbal sounds if the sounds in close temporal proximity. So for instance, if we say, if we get them to hear a 1 kilohertz sound and a 1.5 kilohertz sound in a very, very close manner, they often find it very difficult to distinguish between the two. But when these sounds are extended, meaning you play a pure tone of 1 kilohertz for, let's say, 30 seconds, and then you also play the 1.5 kilohertz for 30 seconds, then they were able to tell the difference or tell the gap between these two sounds. And this is due to the child being provided more time for processing successful elements in a stream of sound. Now, how about CAPD and learning difficulties? So what research shows is that children with learning difficulties are about twice as more likely to fail CAPD screening, especially in dichotic listening, or the ability to understand two different speakers at the same time, and an auditory closure, meaning the child's ability to understand degraded speech. In particular, children with learning difficulty, have difficulty with temporal processing, which affects their reading ability, dichotic listening, which affects their listening, attention, and short-term memory, and auditory short-term memory, which affects their attention and short-term memory. Now, when we delved into this a little bit further, what we found was a temporal patterning deficit or temporal processing deficit was most likely due to a poor reading ability. And often the reading difficulty is a first indication of learning difficulties. And what we find is actually the poor reading ability in children with learning difficulties might be related to for them also having central auditory processing difficulty as well. Dichotic listening deficit, on the other hand, what we find is that children with poor performance on dichotic tests have been seen with children with a range of listening difficulties and language impairment. And this could also be due to a maturation delay of the central nervous system. And these children in general have poor attention. But now then it's a question of chicken and egg. What came first? Did learning difficulty come first? Did auditory processing difficulty come first? Or was attention difficulty was the first thing that came? What we found was that these difficulties are all associated, but they're not causal, meaning they don't cause one disorder and vice versa. Now, short-term memory deficit in children with CAPD and learning difficulties are most likely due to poor attention and short-term memory ability, meaning children with learning difficulties are reported to be frequently off task and easily distracted. But while attention and auditory processing auditory processing overlaps, they're thought to be separate processes. And at the moment, the relationship between attention and its effect on auditory processing in children with learning difficulties are still being investigated. But school-age children with auditory processing difficulties shows higher rates of reading fluency and accuracy deficits. They often have difficulty comprehending speech in a competing or reverberant environment, and they also have difficulty following auditory information, especially in noisy environments, and they often have memory deficits as well. Now let's talk about CAPD and ADHD. Children with ADHD are often likely to present with difficulties carrying out tasks that challenges the auditory nervous system. Meaning, in comparison with normal children, the performance on central auditory processing tasks drops down significantly. So they often perform very poorly compared to your normal peers. And this could be due to a deficit in sustained attention. These children with ADHD often have difficulty holding their attention, which means they have poorer executive function. Executive function, as you all may know, are a set of cognitive processes that are essential for determining cognitive control over behavior, the monitoring of such responses, and thereby helping to attain a desired goal or reaction, which is incredibly important for attention control, cognitive inhibition, cognitive flexibility, working memory, etc., etc. And these deficits can often result in language deficit, poor learning, poor problem solving, etc., etc. And children with ADHDs who are under stimulated medications, such as Ritalin, have actually shown improvements in auditory processing abilities as well. But what makes this complicated is that children who have CAPD and ADHD may have difficulties actually due to a learning disability rather than CAPD. And this is because approximately 25% or 25 to 40% of children with ADHD have some sort of a learning difficulties. And some research have postulated that CAPD in children with ADHD could be associated with the presence of learning disability rather than hyperactivity, which is what we think at the moment. Now, the explanation of one disorder as causal to another is still unclear, and further research in this area is still required. So how about CAPD and ASD? About 9% of children with CAPD have also been diagnosed with ASD as well. And children with ASD often have difficulties with decoding acoustical features of complex stimuli and temporal processing. So often these children have difficulty understanding between a compliment and a sarcasm. So if I tell a child, nice shoes, versus, nice shoes, you can tell that the first remark was me being impressed with a child's shoes, and the second remark was me being sarcastic, going, it's like shoes at nice, but I'm going to say nice shoes. Children with ASD and CAPD often have difficulty telling the difference between the two, and they go, oh, thank you. Yeah, they are nice shoes, which makes for a very awkward social situation. Now, these difficulties could also be due to a broader speech perception and expression in children with ASD as well. Often children with ASD have impairment of speech, so that could be a primary deficit. But what research is now looking into is impairment of speech in children with ASD actually due to a CAPD issue? So again, it's an ongoing areas of research. Now, as you can tell so far, CAPD is a quite complex disorder, and this is because there's a lot of other disorders that are comorbid, and it's really difficult to tease out what causes what and what attributes to what. So does this mean that CAPD causes all these disorders? Well, not necessarily, and it is really important to recognize that CAPD is a heterogeneous disorder, and the relative impact of the central auditory deficit on functional abilities will be a result of multiple factors. And this is because, similarly, language, learning, and related deficits are also heterogeneous as well. And this has resulted in some researchers postulating that CAPD does not exist, nor does it result in meaningful disability affecting learning or related functions. But of course, this depends on who you're talking to. If you're talking to an audiologist like me, I would tell you that CAPD is a real disorder and it has a real impact on children. But if you talk to other professionals, they may tell you something different. So you may ask, all right, Robyn, I think I get the gist of CAPD. How do I manage it? Now, because CAPD is such a heterogeneous disorder, there's no one single definition of what it is. And what that means is that there has been many, many approaches to managing CAPD assessment and rehabilitation as well. And there's, unlike your hearing test, there's no screening for CAPD, but currently screening protocol is being trialed here in Perth as well. And there's also a diagnostic approach as well. So let's talk about this very briefly. So right now, there's no screening protocols for CAPD, meaning at school entry, there's no way to screen a child for CAPD. What this means is that these first screening is often left to parents, teachers, or their general practitioners, which makes it really, really tricky. And the positive first screening means when the parent or teacher reports a child showing behaviors associated with CAPD, such as the one that I spoke about before, like difficulty understanding words in a noisy environment, difficulty following instructions, or asking for frequent repeats. And this is mitigated by overlap with behaviors shown in other disorders, although any resulting increase in false positive findings may be acceptable in screening as well. And what you'll often find is that parents will often visit their GP or pediatrician as first a call, which makes it so hard for the GPs and pediatricians because often they're going, well, you know, I don't know if it is CAPD or if it is ADHD or if it is ASD. Very tricky to do. There are some screening questionnaires that you can use, but they're either very, very long and it often needs to completed by a parent or a teacher. And because they are several pages long, often they don't get completed correctly, which means that those questionnaires, even though they can be quite useful, aren't often valid. So once a child has been identified as potentially having a central auditory processing disorder or CAPD, then they get referred to an audiologist like myself, and we will do a diagnostic assessment of CAPD. Now, there are about 7 different ways to test, or not 7 different processes that we can test in central auditory processing disorder, but often we test about 4 to 5 because if not, the assessment will be way too long. So often CAPD diagnostic assessment goes for about 2 hours with about a 10-minute break in between those assessments for our child to sort of not be overtired. And the purpose of the diagnostic assessment is to assess CAP in isolation. So we assess areas such as auditory discrimination. Can you differentiate similar acoustic stimuli that differ in frequency, intensity, or timing? Auditory temporal processing and patterning. Can you analyze acoustic events over time, such as sequencing and patterns, gap detection in speech or sounds, etc., etc.? Dichotic speech. Can you separate sounds or integrate sounds that are being presented for each ear? So things like dichotic digits, where you get the child to repeat numbers that have been repeated to them in both ears. So they'll either hear 2 numbers on the right or 2 numbers on the left, or 1 number on the right or 1 number on the left at the same time, and they've got to repeat these numbers back in any order. Monaural low redundancy speech is your degraded speech. Can you recognize your degraded speech stimuli presented to one ear at a time? So here what we do is that we will present a word that has been modified, filtered through a low pass, and it sounds very muffled. And a child requires to repeat those words back, even though the words are not very clear. Binaural interaction. Can you binaurally process sound using interaural intensity or time differences? So if you hear one sound in one ear and 1 second later you hear another sound in another ear, can you tell me which sound came first and where? Electroacoustic measures. So these are your objective tests of CAPD. Now, this is not being used clinically at the moment, but for research, we use them. So essentially what we do is we put an EEG cap or put electrodes on the child's scalp, and we present certain sounds, and about 20% of the sound, 20% of the time, the sounds are different. So for instance, they'll hear ba, 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 da. And every time the child hears a sound that is different, a brainwave will show a massive increase in brain waves, basically, because if the child can detect that odd sound. Children with CAPD often can't detect that odd sound, and that's another way to assess for CAPD as well, especially in those younger age children as well. And of course, electrophysiological measures such as other types of brain recordings, such as your auditory brain stem response, middle latency response, etc., etc. Now, one thing I would like to note is that children with CAPD often can't be assessed for diagnostic assessment until they hit the age of 7. And this is because before the age of 7, the language isn't fully developed. And what that means is because a lot of the tests are language heavy, the tests are actually not going to accurately assess their auditory processing per se. So what that means is that the child has to wait till they're 7. But new research are coming out these days where, like I said before, we can use electrophysiological measures or electroacoustic measures to see if we can assess these children younger than 7 for auditory processing difficulties. So what are current treatments available for CAPD? So there are a few out there at the moment. The first is a bottom-up approach, which basically tries to improve the signal to noise ratio for children in the classroom. So the bottom-up approach aims to improve the quality of the acoustic signal delivered to the listener, while the top-down approach aims to improve the ability of the listener to make use of the delivered signals. So as you can see on the top, a remote microphone system is often used. You may have seen them, where a teacher wears the microphone here around their neck, and the child wears a hearing aid-like device, which is really a remote microphone receiver, so that the teacher's voice can come to the child's ears directly, which improves the signal to noise ratio, which also helps with attention, etc., as well. Now, what you'll often see too is auditory training as well, to train very specific auditory processing skills. So they're what we call a top-down approach. So for instance, if a child has a temporal processing deficit, that's one thing that they will work on. So there's a few out there, such as Soundstorm, and they're often app-based, and they're sort of game. They're designed to be like a game. So a child listens to sound, and if they can get the sounds correct, then the spaceship moves one planet forward, etc., etc. If their child has a language difficulty, you'll often send them to a speech language therapist, or also to a psychologist for cognitive behavioral therapy if they have other issues such as anxiety, self-esteem, etc., etc. And we'll often talk to those child about compensatory strategies such as active listening, metacognitive, and metalinguistic strategies, meaning techniques that they can help individuals to understand their own thinking and learning processes. And metalinguistic techniques are used to enhance understanding and control of the language as well. Now, you can imagine for a young child, these compensatory strategies might be really, really tricky. So what are some of the disadvantages of current treatments? High cost. So remote microphones can cost from about $1,500 to an upward cost of about $6,000, which is very, very expensive, especially in this current climate. For those auditory training types of treatment, it requires high cognitive levels, and it also requires a child to focus as well. Now, you can imagine if a child's been in a school for about 7 to 8 hours, for them to come back home and do 1 to 2 hours of these game-based training is really difficult. So often, even though these game-based approaches show improvement, the adherence is a problem, and research shows that whether the research questions whether there's an actual long-lasting, long-term benefits as well. And also, they often have low engagement. In terms of remote microphones, when the child's younger, when they're in primary school, often they're happy to wear them. But as they get older, even 9 or 10, because they start to get teased by their peers, or they're singled out as having some sort of problem, what you'll often find is that the child won't want to wear these remote microphones, even though it helps them. And what you also find is that teachers finds annoying to have the microphone around their neck, and this is also because the microphone needs to be turned off during break. And there's been reports of teachers taking the microphone to the break room and talking, and the child hearing the teacher's conversation the whole way through, which is obviously not that great. And on top of that, there's no single option that currently exists that addresses CAPD and co-occurring challenges such as mental health issues, self-esteem issues, anxiety, etc., etc. So there are some new treatment options coming out for CAPD. So music therapy has been shown as a potential to improve auditory processing in these children. So things like, learning to play piano or singing or, learn to play an instrument seems to really improve children's auditory processing as well. Of course, the downside is that it requires massive time commitment and music lessons can be quite expensive. Here at UWA, what we're exploring are two things, exercise and music. So using rhythmic exercises, so exercise with music to see if that can improve auditory processing. So here you can see a little kid doing hopscotch to the beat of the music. What we're finding is that there are improvements in auditory processing abilities, especially in spatial processing, so the child's ability to process sound in a 3D environment, and also dichotic listening as well. We're also looking at how dance can improve auditory processing as well. And this is because dance requires temporal processing, and research shows that dancers have improved temporal processing as well, which is crucial for speech understanding. Now, this research isn't at infancy, but as it goes along, I'm sure I'll be able to come back and update you on the research as well. All right, well, that's the end of the workshop lecture today. Thank you very much for listening, and do you have any questions?
Hi, Robyn. This has been great what you've been telling us, and it's very interesting research, and especially with the outcomes that we've been able to look at here.
Yes.
It's very promising for a lot of our young people who don't even know that they're struggling, and we don't know that they're struggling.
Yes.
So thank you for that.
No problem. It's really funny because remote microphones are so expensive. I mean, even the patients we see as a research, they'll go, we love to buy remote microphone set for kids, but it's so expensive. And then when they're about 8 or 9, the kids goes, I don't want to wear it. So that's why we started to look into different ways of, treating the kids without singling them out, because I think that's the problem where it's sort of, making them stand out. And, that's obviously a massive problem in teenage years. And, just because we want to treat auditory processing disorder, we don't want to cause them mental health issues or, just stress or whatever, which ends up often happening. So interesting stuff, but I'll let you know. The cost of the microphone system depends on who you go to. I think it can go from about $1,500 to about $6,000. But the price fluctuates depending on where you go, what model you get, et cetera, et cetera. And the difficulty is that those the microphone itself is fine, but the receivers are quite small, and often kids can lose them as well, which often is a problem. What is the benefit of labeling disorder? That's a great question. I don't like the term disorder personally, because I think we all have some sort of disorders as human beings, and therefore, calling it a disorder, it has that negative connotations. But I guess that's like, I guess that's like a more of a historic reasons. But what you'll start to see in the literature is that instead of using CAPDs, people start to use central auditory deficit or listening difficulties, or things like that. So hopefully there's a shift coming through as well. Sandra, I think you have a hands up, but I'm not sure if it's from earlier this morning. Cool. All right. Well, if there's no other questions, I might close the session. Thank you very much for coming and listening, and I hope you have a wonderful Monday and a wonderful week. Thank you. Bye-bye.
Bye.